I really like training. I like working with people face to face, but at this point in time, kind of like with our safety councils, we're kind of going to be limited to working with everyone virtually, whether it's for consultative services or if it's training. So I did want to let everybody know about some upcoming training sessions that we have. The first one's actually going to be later on today. So on the 15th of today at 11 a.m., there's a webinar that's being broadcasted around the state. It's called Avoiding Hazard Communication Program Mistakes. If I could just pause on that real quickly, I really think if you could, I know it's short notice, but if you could try to get somebody from your company to attend and listen to that. And the reason I want to say that is just if you look at OSHA's citations that they typically hand out year after year, fall protection's pretty much always going to be number one, but HazCom generally is second on that list. So, there's a lot of construction companies that are tuning in right now. I mean, you're on deck essentially for those top two citations. So if you can, try to have somebody check out this webinar. If you were to actually remove all construction companies and you just looked at general industry companies across the board, if you looked at the top 10 citations for general industry, there's 3 different types of HazCom citations that fall in the top 10. It's number one's a written program. Later on down the list is a lack of SDS sheets, and then lack of training as well. So 3 of the top 10 citations for general industry companies revolve around HazCom. So again, if you have a chance to check that out, please try to tune in for that. Again, it's at 11 a.m. I know that's short notice, but if you can tune in, hop on our website, you'll be able to log into that and check it out. On the 22nd, there's another webinar we're putting on, What's Wrong with That? A look at real fire hazards. Typically, the consultants like myself around the state are the ones putting on these webinars and e-learning modules. This is actually going to be presented by somebody from the State Fire Marshal's Department. On September 29th, there's another webinar, Heat Stress, Cold Stress. You've got to love Ohio, right? So with these temperature swings, a lot of people tuning in right now. You have employees that are working inside and outside. If you have employees working outside, they're exposed to the cold temperatures coming up in our winter months, but then you have that swing into the summer months where people are potentially exposed to extreme heats. So you may want to consider that, but even if you're maybe fall in the general industry, you have people working inside of a warehouse, it can get very hot over the summer months, especially if somebody's working on some type of piece of machinery that's putting off a lot of heat. So that might be another webinar you may want to tune into. If for some reason you don't get a chance to hop onto that webinar later on today, or there's any webinars that we put on you've missed, you can actually go to our BWC Learning Center. So you could just go to any search engine like Google and type in BWC Learning Center, and it's really going to be the first hit you typically run into. So if you go to this page, the only thing you need is your policy number, and you'll be able to create an account. It literally takes about 2 minutes to create an account. And then you can hop on and view any of the past webinars. You can enroll in a lot of online e-learning modules. We've got a variety of courses around safety and health, ergonomics, record keeping, industrial hygiene, and even controlling workers' compensation costs. We just released a new YouTube video. It's real short. If you are working from home like a lot of us are, Brad Ridenauer, he's an ergonomist out of our Dayton office. He's a great trainer, but he put a 4-minute YouTube video together, and he's showing you a few things that you could watch on this 4-minute video and go ahead and implement those things today. He's not going to tell you to go out and buy an expensive $500 desk or chair or anything like that. He's going to give you some tricks on things that you have right now and ways to maybe make your workstation a little bit more comfortable. Moving on to some programs we've got, the BWC has a program, Protecting Ohio's Workforce. We've got you covered. So the BWC has currently shipped over 20 million masks to 197,000 employers around the state since May. We're actually scheduled to send out 23 million additional masks later on this fall. So the funding for this project is coming from the BWC's Division of Safety and Hygiene. That's where I fall into play. And what I really like about this program is every effort is being made to purchase those supplies from Ohio manufacturers. NIOSH has made several updates to their website. The first one is on employee stress. They have a science blog. They typically update once or twice a month, but they've recently updated that to try to help employers cope with employee stress during the COVID-19 pandemic. They have some tips on carpool safety, some tips on preventing the spread of COVID-19 while carpooling. and then also hazard communication for disinfectants. And generally across the board, probably more and more companies have large amounts of hand sanitizers and cleaners and disinfectants. Your HAZCOM program potentially needs to reflect that, so that may be something you may want to hop on their website and check that out. OSHA's updated a few things on their website as well. A lot of you probably already know this is actually the week they moved the safety stand down to, so we're right in the middle of that. So it's from September 14th through the 18th. And I know in 2018 they released the number of 320 construction fatalities from falls happened. It is a voluntary event to educate employees about fall hazards. If for some reason you're involved in any type of stand down activity, throughout the presentation at some point in time, maybe you could share that in the chat room and let people know what you're doing. OSHA's also updated their frequently asked questions website on COVID-19, specifically regarding wearing masks and carbon dioxide and potential oxygen levels. It's very short, but it's just a couple updates they made on their frequently asked questions site. And then the NFPA, they've released a couple new fact sheets. Number one is building and life safety issues for tents. There's a lot of companies right now that to kind of expand their footprint and increase social distancing, they've added tents to their property. So they give you some tidbits and tricks for outdoor seating, egress, occupancy, flammability, and your location of the tent as well. And then that second fact sheet they updated was building and life safety issues for safety and reopening schools. They're specifically going to speak about evacuations, drills, building modifications, and the hand sanitizer placement and storage. If you were to actually look at this, you could probably take those things, even though it's titled for reopening schools, it could probably translate to really the majority of companies across the board. So those are the updates I have for the BWC. I'm going to put my information down in the chat room. Feel free to reach out to me. I'll put my cell phone number down. I'll put my email down. I'm happy to help you in any way that I can. And look forward to working with you in the future. And I'll go ahead and turn it back off to hand it back over to Susan to introduce the speaker.
Okay, I'm unmuted now. Let me say again, thank you so much, Greg. And let me introduce to you this morning's presenter, Jeanette Weisbrod. Jeanette is General Manager of Occupational Medicine with TriHealth Corporate Health. She's been with them for more than 25 years, and she provides oversight for the business operations of 5 medical clinics at as well as a random drug and alcohol program, as well as on-site and mobile medical and work capacity services. So she's very familiar with circumstances and situations that you all find yourselves in. Her career has spanned areas of cardiac rehab and prevention, cardiopulmonary testing, corporate fitness, and rehabilitation. And this morning, she is going to bring us up to date with the very most recent information regarding COVID-19. Jeanette, feel free to share your screen.
All right, well, thank you. Let me grab my screen here. All right, well, good morning, everyone, and thank you, Susan. It's a pleasure to be here with you today. What I'm going to talk about a little bit today is COVID-19 basics. And as you all know, COVID-19 is ever-changing and all-consuming, and there's a lot of information out there. Some of the information has stayed the same. Some of it has updated. Recently, I'll even talk about some other things too, where there's been a lot of updates even over the weekend. So it is constantly updating. So today I thought we would just go over some basic things: risk factors, human health, transmission, some recommendations for reducing the transmission, testing and quarantine, health and wellness needs, and then just looking ahead to see what some of the predictions are for the future. So as I mentioned, it's ever changing, and what we're finding out is that people are in different places. So whether it's individuals, whether it's employers, the employees in working in the workforce, you know, each industry, employee may be in a different place, and it's something for us to all take into consideration. So some are open and prepared and up to date. They've either been open the entire time, they've successfully reopened, they've got their safety measures in place, they keep changing, they're paying attention to everything, they're evolving as things evolve, and there's a strong emphasis on employees following those guidelines. Others opened when there was the big rush to open, they were successful with it, and then status quo after that. Everybody went back to just kind of doing everything we knew. There were some that opened with very little prep. They just either remained opened or reopened with little changes. The employees don't have very many guidelines to follow. And then we still have companies that are partially open. We've got people on furlough, a lot of people telecommuting, and then there's still some that are preparing to reopen. So the difficulty is really the amount of knowledge and the place in which everyone is right now are all in different places. So just a little bit about the disease. This is, of course, it's the coronavirus disease for 2019, and it does get its name as the corona, as you can see from the little protein spikes that envelop the virus. It kind of gives it its distinctive feature. But it is a serious infection, and I know there's debates on the disease itself and all the things that have happened surrounding it, but it is a serious infection. Infected people sometimes never even have symptoms, though, 1 out of 5, which makes this very tricky because unlike the flu or something where it's pretty obvious who's sick, this one can be a little different. That asymptomaticness is more common in younger people with no health problems. Some people have mild cold symptoms. They may just need to go see a doctor. Others have been hospitalized, ICU, and then even death. So it can be serious. Some people, it's more serious than others. And really, there are a few risks. And one is age, and then there are other health issues. So really with age, the risk is around 60 or greater. And to compare that, a death rate for a flu in 2009, which was a very high year for death rates, the average age was around 50. And for COVID, as you can see, the average age is much higher at 82. So it does affect older individuals more than it does younger. It also affects those who have chronic conditions such as lung disease, immunocompromised, being a smoker. Obesity is actually one of the most effective things that is being kind of looked at now, in that those who have obesity have a higher tendency to have higher symptoms and complications. So that in combination with other things such as heart disease, cancer, liver disease, can really make this dangerous for people who have multiple comorbidities and then are infected with the disease. Most of the symptoms are still seeming to appear about 2 to 14 days after exposure, and those are fever, cough, altered sense of smell or taste has been a really big one, and that's a lot of times the only symptoms that some people have, especially the younger ones. And then stuffy nose, fatigue. As you can read, it kind of goes the full gamut, but the biggest ones are the fever, the cough, shortness of breath if it's really affecting the individual, and that loss of sense of taste and smell. So the thing about it is, and since the beginning, again, so much research and really kind of looking at how this is transmitted. And knowing how it's transmitted helps to understand how to mitigate it then. So to compare things, this is just a little bit of a comparison. The large respiratory droplet on the right is still smaller than the naked eye can really see. You've got smaller droplets and very small respiratory droplets. And then you can see on the left-hand side in red that coronavirus. So it is very tiny, even compared to a normal respiratory droplet that would be coming out of your mouth when you speak or when you cough or sneeze. So from a person-to-person transmission is really the largest way, or the most way that this can be transmitted to each other. So really it's being infected by breathing in those virus particles I just showed you. It sounds really gross, I know, but you're breathing that in every time you talk to someone. And obviously the closer you are to someone, the more that's going to project from their mouth into your mouth for you to breathe. So that is really why that 6 feet distance kind of comes about. Those larger particles at about that distance tend to fall down then and won't enter into your mouth as you're talking to someone. So the longer you're around someone who's infected and the closer you are to them as if they're infected, increases your risk. Touching an infected surface can also lead to infection, but it's much smaller. Really, if someone sneezes, you touch that surface and then touch your face or touch your mouth, you could bring that in. Not touching face or mouth or keeping workspaces clean should minimize that, but it's really that personal contact that is what we're finding to be the biggest risk. So what makes it contact? So you always hear about contact tracing. Well, it's just that. It's really being near someone for 6 feet or less and that 15 minutes or more. Someone between 48 hours from the time they showed symptoms and 10 days after their symptoms. That's when that transmission can be the highest. So those 3 things together, being around someone that is highly infected, being around them for more than 15 minutes, and within close proximity. So it's all about reducing transmission. The CDC really recommends everybody needs to social distance, wear their masks, and wash your hands. They've added a few more, cleaning and disinfecting, but really these 3 things, the social distancing, the wearing your masks around other people, and washing your hands throughout the day are the 3 key things that everyone can do to help reduce transmission. So we've probably all heard about hierarchy of controls. There's different models of it, but it's really how do we eliminate any risk? So in this case, I'm talking COVID, but obviously in the safety realm, the hierarchy of controls is really how do we eliminate risks? So of course, the most effective is elimination. With COVID-19, that's a little impossible because we would literally have to isolate ourselves and away from everybody else to completely eliminate it. So the things really that are important that we can affect are engineering controls, such as physical barriers, and then administrative controls, things that we can do to put people in situations that reduce the risk. And then last line of defense, but still really important, is the individual use of either PPE or even in this case, the masks. So really, the engineering controls are something that everyone is looking into a lot. I know, if you were going to buy stock in some things, I think the little plexiglass would have been a great thing because that has been erected everywhere. So everywhere you go now, there's that barrier of plexiglass or something else between you. And the reason being, again, goes back to that 6 feet and those particles, because it can help shield that and keep that from getting to the other side of the glass. So those physical barriers are very important. If you're working even in like construction, I know some of the recommendations are sheeting, keeping people in different areas as they're working, and having, even if it's the plastic sheets that are kind of in between each makeshift walls that can create barriers, anything you can do that can create a safe barrier. The caveat to that is not to create so many barriers that you've now created safety incidents. So you don't want to, you don't want to do things that are going to affect your ability to get out safely in case of a fire or anything of that nature. So you don't want to do anything that's going to make ergonomic issues. And so you have to consider things as you're creating different barriers. You also have to make sure that you're considering the consequences to what you're doing as far as the workflow goes and actual physical flows. The other thing is ventilation. Ventilation is really important. You know, recommendations to be outdoors right now for reducing risk of transmission are big, because in the fresh air, you know, you've got the wind blowing. It's a lot easier for those particles to go away and kind of be disseminated into the air. Whereas if you're in a very close, confined area with no ventilation, then it's going to continue just to kind of be in the air or build up around, and especially then again if you're within that 6 feet proximity. You want to use fans to blow air away, but do not use those fans to blow onto others. So people have been utilizing fans to try to make airflow, but you know, you don't want to take a breath and then have all of those particles go blow onto your friend, you know, just around the bend from you. So make sure that as you're using airflow, that again, it's not impacting someone else adversely. Make sure you're routinely cleaning the ventilation systems and install filtration if at all possible. If there's an opportunity to get fresh air as opposed to recirculated air, that's also going to be much better, because again, you want to get as much fresh air as you can in. Some of those administrative controls then are really avoiding crowds, particularly indoors. You know, that's really the worst case scenario, having everybody on top of each other indoors, breathing all with no air circulation, breathing on top of each other. Teleworking when possible. I know so many people are doing telework, and it has its downfalls too. It's you know, then there are other things we want to consider too. So just keep in mind that changes always have kind of a trickle down. You know, there's a cause and effect. So, you know, if you've got everybody telecommuting and everybody's isolated, then we have to kind of look at mental health and what that's doing for people too. So a lot of considerations to keep in mind as you're keeping yourself safe from the disease and making sure that you're not causing extraneous issues on the other side. Consider flexible hours and rotating shifts. So the fewer people you can have in one area, again, either extending shifts, having people work at different times, really no more than 50% of the fire code, still a good recommendation. Increasing physical space just between people. So if not even having to reconfigure from a physical barrier, but if you can just spread people out. Encouraging single file movement. I don't know if any of you have college students now, or maybe even in our schools. I haven't been in the elementary schools, but I know most of the colleges now have enter doors, exit doors. And the reason for that is single file movement. So you're not constantly passing people where they're going to be breathing on you as you're passing them, especially when you've got lots of crowds. So again, it kind of goes back to that maintaining the 6 feet distance between you and everyone else. A few more, just those visual cues. Of course, we've all seen, you know, stand here, keep yourself distance. One thing I have personally noticed is it's becoming like every other sign now. People are starting to ignore them. So make sure that, you know, that you're encouraging people to adhere to them. Because if you've been to a, like one of my favorite stores, Costco, nobody was paying attention to the little things on the floor right on top of each other. So it's important that you do make sure that people are paying attention. And then, you know, that you could have different work teams, limiting group meetings such as this. Great idea, having it all virtually. Some really common mistakes. So people can do all these great things, and then the little things are where there's some common mistakes. Talking in the stairway. So, you know, you're coming and going, and people stop and they stop to chat, and they're real close to each other. Being within 6 feet of coworkers on breaks. You know, I've seen people in break rooms, masks off because they're eating, and again, they're right next to somebody. There's 8 of them at a little table. So you let your guard down, you're on the manufacturing floor, you're out doing work wherever, and then all of a sudden you go to eat and kind of gloves off. So, and then shaking hands still. Most people have really kind of gotten away from that, but there's still seeing that. And so just little mistakes that people can do, and especially that break room one. You know, again, your mask is off and you're real close to people, and your fingers and mouth and everything. So a little bit about personal protective equipment. Again, we're not going to say it's the same as we know as far as N95s and what have you, but for this, masks of any sort, especially the cloth masks or the procedure masks that a lot of people are wearing. So they do reduce the viruses, and then face shields can also offer extra protection, or especially for people who really can't wear those masks for health reasons, a face shield can be an alternative. The thing about it is, though, you really need to wear it properly. So I know we've probably all been out to the grocery store or pretty much anywhere else where you've seen either the chin wearer or the one who wears it right below their nose. You know, it doesn't help reduce those particles coming out, especially when it's at your chin or around your neck. The other thing is making sure that you're laundering them, you know, because you do have on the outside, you're going to have bacteria. On the inside, you're going to have a lot of stuff that you've been breathing. They can get moldy. It can be disgusting if you're using them over and over and over. So they should be dry. So if you get wet, you want to make sure that you get a new mask as well. And then take standard precautions when removing masks. You should have remove it by the ear loops and then fold it. If it's disposable, you want to take that and throw it away. If it's to be washed, place it somewhere where you can, ideally directly into the washing machine, but most people aren't going to wear them in their cars all the way home. So just make sure that you're putting it somewhere safe, inside a paper towel, even something that you're not letting it touch everything else. For gloves, those should be worn when you're cleaning and disinfecting. You want to make sure that you also wear them if you're caring for someone who's sick, especially in your house. Don't reuse gloves. To remove them, make sure that you can take it off one hand by grabbing the palm, and then your clean hand should really slide underneath the other glove so that you're not touching the outside of the glove then. So some basic things as far as just a little bit of removing things, but things that everybody needs to also take into consideration. Make sure you discard them in a lined waste container, and then always wash your hands or use sanitizer after removing them. So masks, big controversy on masks, and there is the new update on the carbon dioxide in masks. There's also another update that just came out about heat and masks, heat indoors and heat outdoors. And so that's something too that you want to take a look at. I did not put that information in here. We have a lot to talk about, so I didn't want to put a whole lot, but those just came out actually September 11th, I believe. And it talks about, you know, some of the dangers or difficulties of wearing masks in hot areas, whether that's an indoor, and some of the examples, especially where, you know, people in kitchens, people that are around kilns or other things that produce a lot of heat from an indoor standpoint. Outdoor was anyone that's working outdoors in the heat. Hopefully we're kind of gone over that hump right now for the weather outside, but it's still getting a little warm, and it can get very warm if you're outside working. And so some of the big things for those were just to make sure, again, that they're not getting too wet. And if you can take breaks from wearing them, go to your car, do other things, that is really recommended, as well as acclimating people. So people have not worn them before. Doing an 8-hour shift in the extreme heat wearing a mask is difficult from day one. So really kind of acclimating people to wearing that mask and understanding what, you know, how they react to it with the heat. So kind of a little thing about masks, we'll go back to that picture that I showed in the beginning. We have our little coronavirus over on the left-hand side. The virus gets trapped inside those droplets that are coming out of your mouth. So the little 5-micron one it's very small, but it is large enough to be blocked by a mask. Some of the smaller droplets may not be blocked by a mask, but as you could, back here, if we look at this slide again, you'll see that there can be a lot of those coronavirus little guys hanging out in those respiratory droplets that can be blocked. And so really that's the purpose of the mask. It's to block those as they're coming out of your mouth. Masks such as cloth masks, procedure masks, the masks that the people are wearing are for the protection of the people around them. N95 masks and those sort and the kind we wear in industry are for the protection of the user. So there's differences between masks. But the reason why everyone is wearing a mask right now and why they're required to wear masks is so you are capturing the particles as they come out of your mask, your mouth into your mask, and hopefully can capture a lot of those. Again, some of those smaller ones may not be caught. So as you can see really kind of on the right, you see that infected, and this person's even asymptomatic because if we remember from before, 1 in 5 people might not even show symptoms. And so, 60% of the infections are contracted from another person with symptoms, 40% someone who doesn't feel sick. So, as you're wearing the person not wearing a mask, talks, coughs, what have you, it comes out. The individual not wearing any kind of mask either, that is the best case scenario for someone to be infected. So again, those droplets coming right out of their mouth into yours. If you are wearing your mask, even though the purpose really isn't for you, it can also block some of those. Best case scenario, both people are wearing masks, both people are distanced, and it really limits the transmission there. So really kind of going back before, what everyone can do. Social distancing, we talked about some things that you can do from engineering controls to also make distance and administrative controls, wearing masks when you're around other people, and then washing hands throughout the day. We've been hearing about hand washing forever and ever and ever, but it really is one of the simplest things, easy keys to reduce transmission. So really, in a day's time, a little trick that you can do is count how many times you touch your face. Because every time you touch your face, you should have probably washed your hands because you're touching everything around you, touching your phones, touching pens, you name it. And, when you touch your face, you're bringing a lot of stuff with you. There's, you can get online, they've got all kinds of disgusting little things where they can do things with blue lights and stuff where you can see all the germs that you've touched, and washing hands really does remove those and eliminate that danger. It's important that you wash your hands often before you either eat or prepare food, after touching your mask, because remember the outside of your mask especially has a lot of those particles that people may have put out when they weren't wearing their mask, or the inside has particles coming from your mouth. After using the restroom, changing diapers, caring for someone who's sick, make sure that you avoid touching your eyes, nose, mouth with unwashed hands. It is really recommended that before you eat, you wash hands. Now you can use hand sanitizer as well. Hand sanitizer does not clean. So if your hands are visibly soiled, you want to make sure that you are washing them. But you can use hand sanitizer to do some of the tasks that we just talked about with washing hands. Really, you have to follow 5 proper hand washing steps, and it seems kind of silly, but I always tell people go into a bathroom and wash people. Hopefully they even wash their hands. That's another topic. But watch how people wash their hands, because chances are most people around us do not wash their hands as well as they should. So you want to make sure first you wet your hands, then you lather, and you really pretend you're a surgeon. You know, it should be in between the fingers, under the nails, around the tops and bottoms for at least 20 seconds. Rinse well and then dry with a clean towel or air dry. Again, a lot of people don't do it, and there's some videos out there that are really great that can show the difference between 10 seconds of washing versus 20 seconds of washing and the amount that doesn't get washed off your hands from the bacteria standpoint. So again, if you are going to use hand sanitizer, seems we've got supplies back now, so that's good, and that should be readily available in a lot of different stations around the workplace, so that people can use hand sanitizer as needed, but make sure it's at least 60% alcohol. And then cleaning and disinfecting. Again, just like with your hands, there's a difference between cleaning and disinfecting. So cleaning will take care of dirt. You can use soap and water, those kind of things. Disinfecting kills viruses. And so you want to make sure that you're using an EPA registered cleaner that is specific to killing viruses, or in this case for COVID. So you can look those up. You can just, you know, Google EPA registered disinfectants, and it will give you a list of ones that work. Make sure you clean frequently used surfaces such as doorknobs, pens, light switches, phones, computers, faucets, those types of things. And then also, I know we talk about a lot about the employment areas and what to do, but keep in mind that after people leave work, they go home. And when they're at home, they also have to make sure that they are taking care of themselves and taking care of the people within that household too. So a major risk of infection comes from home. So nobody's wearing their mask inside. Family members are all close to each other. There's a lot of preparation of food and what have you, a lot of sharing. So just make sure that individuals know that as well. You know, family members, especially those over age 70 or even as young as 60 who could be at high risk, really need to be monitored, taken care of. And then, you know, avoiding high-risk social situations and big gatherings. Really take the opportunity to educate everybody about the transmission and how to mitigate it, so that, you know, we can hopefully get back to, I don't want to say the new normal, it's such a cliche, but a different normal that's not this one, something where we're not consistently worrying about the transmission. So we've heard a lot about, we get a lot of questions about testing. So in the beginning, it was a lot about antibody testing. Now it's a lot about the differences in the different types of testing, and when to test, and why to test, and who to test. And this is something actually that has also been changing very frequently as far as the guidelines and recommendations on when testing should happen. You know, really what to do if you're sick is the most predictive symptoms, as we talked about, are the fever, decreased in smell, cough. You can have muscle aches too, and then shortness of breath. If someone in the workplace is sick, they need to go home. You don't want them to hang around. You don't want them to have the risk of infecting anyone else. They should make sure that they reach out to their primary care and discuss what the options are, whether they should get tested or not. Stay at home, limit contact until 10 days after the symptoms start. They're fever-free for 1 day. Flu-like symptoms are much better. So that kind of brings us into the fact that we're about to hit flu season as well. So another big thing that can really help is if everybody is encouraged to get those flu vaccinations, because there will be a lot of similarities between the two, COVID and the flu. There are some differences as well. There are going to be a lot of sick people, and so you know, the healthcare system can be overrun with sick people, but then we're also going to have a lot of people where we don't know, is it flu, is it COVID, is it something? And so if people can at least be vaccinated with the vaccines that we currently have, that will help minimize the amount of illness that we have circulating around the area. And then also either talk to your employer, or if you're the decision maker, make sure that you have what documentation is required for people to return to work, and discuss what kind of options are available for sick pay. So some of the testing, so there's the PCR test, which is really the most accurate. So it really looks at the DNA of the virus, and it can really tell if you're at risk of infecting someone else. It's best to test about 8 days after exposure, but 3 days after symptoms start. I think some graphs I've seen have day 3 and 4 kind of at the little highest as far as testing positive. And then if highly suspicious of a COVID-19 infection, one negative test really doesn't give you a free pass to go back and possibly infect everyone. I know personally, I've had a few people were pretty positive it was COVID for whatever reason. They continued to test negative, even though they had loss of smell, taste, all of the classic symptoms. Sometimes it is the process in which the test was done. So, the testing device itself has a special limit of accuracy, but then combine that with human, trying to get a sample up the nose or throat, what have you, then it also adds to the variation. So sometimes it could be the tester or the test that maybe produced a false negative. Then there's the antigen test. So it's more rapid, not as accurate. And if it's negative and you have no symptoms, you may have to go back and do a PCR test. So there's something kind of a in between, we'll say. It's a molecular test that tests the protein of the virus. And I know there's some tests out there that have been emergency use for testing for that from the FDA. And those are showing to be very similar to the PCR test in their accuracy. So, that is also out there. And so they are a rapid test. So not every antigen test is a rapid test, but not every rapid test is an antigen test. Again, there is the molecular test that can also do rapid. So there's kind of a little hybrid of the two, if you will, as far as testing. And I know they're using those a lot in healthcare, especially for when they need to get symptoms under control, or perhaps surgeries, those kind of things. They are going to those molecular rapid tests so they can have those results back quickly. And then there's the antibody test. So again, that can be used to tell if you've been exposed, but it really is more used for epidemiology rather than for really doing anything. You really can't use it to say, okay, now you're immune, or you can come back to work, those types of things. It's really more just to kind of study the spread of it and to see how long antibodies are lasting in individuals. So it's more from a public health use than it is for the public use. So these are some newer considerations for diagnostic testing. These are as of August 24th. And then again, some of these things were just a little bit updated over the weekend. But really, if your symptoms are mild, they're recommending you call your healthcare provider to see if you need the test. So I know in the past it was kind of like mass, everybody go, go, go. But now it's really, let's talk through it. And I think some of this is coming about too, because as we enter into flu season, everybody that's sick is gonna first assume COVID before anything else. And actually, I know right now in some of the colleges, there's been a really high increase of mono, and those children are first being tested for COVID, coming back negative, and then they're coming back and getting tested for strep and mono, which, really it should be all done at once, because we don't want to delay care for anyone or anything. So that's important to kind of discuss over with your healthcare provider what your symptoms are. If you test positive or you don't get tested, you really should self-isolate for 10 days. or at least 24 hours after the resolution of any fever too. You know, again, that's going to be a tricky one if your healthcare provider doesn't recommend that you get tested, and now you have to try to go back to work, or you as the employer may have to try to manage individuals who don't have a record of any test other than their doctor saying, yeah, isolate for 10 days. So that's going to be a little bit of a tricky one. What I've seen right now is most healthcare providers are still recommending that test actually happen. If the symptoms become severe, you should go seek help immediately. And then if you take a test and test positive, you don't have to repeat the test. And actually what's just come out now is that if you have been positive in the past 3 months, unless you're showing symptoms again, there's no need to repeat the test. So if you've been exposed to someone who has been tested positive and you've been in you know, closer than the 15 minutes and 6 feet, then, and you've had a positive test in the past 3 months, they're not recommending you even get tested again unless you are showing symptoms. So that's one new change that's just kind of come out. So that pertains to this next section about being in contact with someone that's close. You know, you don't necessarily need to be tested unless you yourself are vulnerable. So again, going back to the slide with some of those things that make you at high risk, age and those comorbidities. And then, you know, if your healthcare provider recommends it, you want to make sure you monitor your symptoms. And then if they do develop and you haven't been tested, make sure that, you know, you kind of contact somebody again. And then adhere to the CDC mitigation protocols, which again are keeping yourself distanced from other people, making sure you're not around them for those long length of time, washing your hands, doing all those things to mitigate. So if you are tested, you should self-isolate at home until the results come back, just because you don't know what they could be and you want to make sure you're not infecting others. And then if you do not have any symptoms and haven't been in close contact with everyone or anyone that has a known infection, the recommendations really are that there's no need to be tested. So that being said, these are general recommendations. There are industry-specific recommendations that do require surveillance testing. So some examples of that are nursing homes, for example. Individuals, before they enter nursing homes for the first time, do need to be tested if they are asymptomatic. And then they also will be tested on a routine basis if there are areas of high outbreak, especially in congregate living places. Those also will do some testing on people who are not symptomatic. So there are some employer-specific regulations that are set out there, and sometimes they're based on the level of transmission in the area, and sometimes they are based on the type of industry, and the frequency of testing is usually based on transmission. But there are different regulating bodies that are kind of putting those out there. And so just know that these are general recommendations and not necessarily specific to different industries. Healthcare providers and first responders have different recommendations for testing, as well as return to work too. So again, just know that there are variations. If you are in a high COVID-19 area and you've attended public or private gathering, excuse me, where people are not wearing masks or physically distancing, you don't necessarily need to be tested again, unless you're an individual that is vulnerable and your healthcare provider recommends it. But again, just like everyone else, monitor those symptoms. So it's really about monitoring symptoms as well. And that should be occurring in the workforce too. So whether it's a self-monitoring that occurs at home or something that's occurring at the workplace before you enter, it is really important to make sure that people are monitoring symptoms. So taking temperatures and looking for symptoms of cough, loss of taste, smell, those kind of things, and whether they've really put themselves in that situation of being with that person who has tested positive for COVID. I know there are some really neat apps out there right now that can track that as well, and you can turn those in. So that's kind of really neat how fast people can pivot and develop things based on what we're going through right now. Just some real quick things. Again, I just wanted to kind of bring a variety of things to you. As I said in the beginning, not knowing really where everybody is and that people are in different places. So I know real quick, and these are just some things that are out there as far as recommendations you would want to consult with your legal department or those individuals who make policies and procedures around these things as well. But, you know, when it comes to symptoms, you know, you can ask about symptoms, but you need to keep that confidential. So if you'd have to send someone home because they're sick, again, you want to make sure that you are keeping the medical information confidential. You can require individuals to stay home if they have those symptoms. Requiring a test to rule it out before coming back, but that's not currently recommended. Again, in the very beginning, it was recommended that you needed a negative test before coming back, but those are no longer recommendations. And then employees with high risk can request accommodations or some kind of temporary assignment due to hardship. And then what you really don't have to do, you don't have to provide accommodations to anyone who's otherwise healthy, but maybe just has very high sensitivity or fear level. Although if there are things you can do, obviously you want to work with your team, but keep in mind, just like everything else, you do something for one, you must do for others. And then although older workers are at high risk, you cannot exclude them from putting them into an area where maybe the risk would be higher just based on age. So just kind of make sure that you are looking at some of those things when you're making decisions. Other human resource things to consider, make sure you're continuously reviewing policies regarding return to work, substance testing, PPE usage, and regulatory compliance. Really those kind of things should be ongoing no matter what, but especially during this pandemic. And then determine if there are any new policies that need to be created specifically for COVID, such as screening and testing, masks and social distancing. And it's important that you really kind of spell out what the consequences with lack of compliance will be, and then have a communication plan to let everybody know what the policy is. You know, the other thing too is just general safety. So what we're seeing too and finding sometimes is that when your brain is focused on one thing, and especially the last 5-6 months that we've gone through and a lot of the stress people are under, you tend to forget basic things that you know from a safety perspective. So make sure that you're following standard operating procedures, you know, safe lifting, carrying, reaching, machine usage, PPE for industry that fall under regulatory requirements, and just everyday tasks. If people have been out for a while and coming back into the workforce, you may need to retrain employees who've been off or on reduced workloads. Try not to forgo routine safety and compliance training. Search for teletraining options or other things that can be done. And you know, don't just say, well, you know, we'll 10 months from now, maybe we'll get another training together. You want to make sure that you're somehow finding a new avenue to get these trainings completed. And then you may need to train individuals on new COVID processes or how new processes coincide with the existing processes. So just a little bit about health and wellness. Just general well-being, making sure people are eating properly, sleeping, exercise, spending time outdoors. You know, this mental health right now in general and general well-being is something that is a really hot topic and a very strong side effect of this entire pandemic. You know, there's preventive care too. People have been delaying out of fear for going to the healthcare system for exposure, delaying such preventive screenings such as mammograms or colonoscopies, things that you want to make sure that you're encouraging your employees, encouraging yourself and your family and friends to don't delay, because these are out there for a reason, and so we want to make sure that people are going to do that. And also we've still seeing, it's gotten better now, I think, but we are still seeing people that are holding back, that really need care, and they're just afraid to go, again, into the healthcare setting for fear of catching COVID. But sometimes the exacerbation of diabetes that they have, or the infection that they have, or just whatever else is going on in their health that they're delaying by not seeking treatment is actually, can be more detrimental than if they had gone and perhaps caught COVID. I will say that, while there are sick people, there are always sick people going into healthcare, but healthcare is actually, very safe and has taken a lot of extra precautions to make sure that they are minimizing the spread of COVID. So, they're cleaning constantly. I should say we too. I mean, we're open, we're ready. We've made a lot of changes within Tri-Health to be sure that as people come in, they're screened, they are being taken care of, they're isolated. If they're answering different questions the way they need, they have, we may or may not allow entry, and depending on where you are. So there are a lot of things that have been out there. So people should be encouraged to seek care when needed. And then chronic conditions, again, managing diabetes, hypertension, those kind of things still need to be done. Most physicians and physician practices now are using telemedicine, so it's a great option for those who still have fear of going into the office directly. And then mental health, really the focus is on what you can do. Make sure you're staying in the present. News and social media are an Achilles for anyone, so make sure you stick with trusted source information. The CDC, NIOSH, PwC's website, all great areas, all places that gather information from trusted resources and put those out there. So make sure that you're looking at that and not everything that's on Instagram, Facebook, what have you. Stay connected with friends and family and other groups. Share your feelings with people you trust. Parenting right now is really difficult for a lot of people, especially with children having to stay home, and especially even if they're staying home because they're symptomatic. Now, any little cough or sneeze is going to cause someone to be at home for quite a while. And so parenting has been very difficult for people especially with younger children. Separating yourself from work and home, long hours, Zoom fatigue, making sure you have a separate location just to kind of go isolate yourself and enjoy. And then self-check, make sure to seek help if you need it. Your primary care, an EAP program. There are all kinds of agencies out there that are there for people that need help, want to seek help. They're there to give it. A few things just about COVID that can add to stress. There's concern about being exposed to the virus at work, personal and family needs that interfere with working, the uncertainty about the future of workplace and employment, adapting to different workload shift and workspace, and then technology. So it doesn't seem like, for some people, those things would be very easy to handle. And for other people, a combination of the 5 areas on the slide can be very, very taxing and mentally draining and very stressful. And so those individuals really need to find a way to manage stress and be able to build resiliency. And so there's a lot of good information on resiliency out there too. So individuals who are struggling with changes in the workforce really can benefit from stress mitigation and resiliency training. Just a little bit about the vision for the future. Really, most experts predict that there'll be mass vaccination to end the pandemic. That's really just like many things that we have out there that we have developed vaccines for, is going to be really the way to end it. more than, and this number is probably even higher now, more than 160 vaccines are being investigated. Some have been showing positive results in clinical trials. Still unknown is how long the immunity to the virus lasts, and if it varies among different people. And then if successful, this could be a yearly problem that's managed similar to the flu. So again, it's hard to say. They keep learning. We keep learning a lot about this and kind of the effects it has, but there's still a lot of unknowns. Just in summary, it does remain a serious public threat. The major tool today is social distancing, and couple that with hand hygiene and masks, and keeping yourself safe. Because of the harm of isolation and some of the other factors that the changes have brought on, it is important that we use controls such as the engineering and administrative screening, hand washing, those kind of things, so that we don't have to isolate people, and as we did back when this first started, because if we have to go backward, then things are only going to get worse. But the future is promising. Again, more than 300 drugs and vaccines are being tested. So the number of treatments that are being explored now, and also the hope that this has somewhat kind of diminished in how it's being transmitted, and then also the effect it's having on individuals. I think we're seeing that a lot of the virus may have weakened, although viruses do tend to mutate. So again, still a lot of unknowns, but really looking for that vaccine in the future to be kind of the end to all of this. So I think that's it. And I think we maybe just went a little bit. So if there are any questions, we can put those in the chat, and then if I don't have answers to them or we can't get to all of them, then I will get those to Susan, and we'll be able to get a Q&A out to everyone as well.
Thank you, Jeanette. We really appreciate all of the up-to-date information. I think I can speak for this group by saying that most of them started very early because construction was deemed an essential service. So they started very early educating themselves, but the information regarding COVID is constantly evolving, and I especially appreciated this morning the fact that you brought some new items to our attention. One I had a question about was that you mentioned something regarding a mask and heat recommendation, or perhaps it was a mandate, and you said that it had come out on September 11th. So is this something new via the CDC, or would we find that type of information on the Ohio BWC website? What can you tell us about that?
And I think, so I'll need to double check if it wasn't September 11th, it was real close to it. So this may have been on OSHA, so I will get that for you. I went through a lot of information trying to make sure that we had the most up-to-date for this, because things have changed so much, and that was one of them that I read. So I'll get the exact link and I can send that over to you then.
Okay, that's great. And Jeanette's slides, as well as a recording of this meeting, will be available in a few days on the ACI Tri-State Area Safety Council website. So that concludes our meeting for September. As I mentioned at the start of this meeting, our Safety Council will continue to hold our meetings virtually via Zoom on the third Tuesday of every month from 7:30 to 8:30 approximately. And you will be receiving meeting invitations with the Zoom link attached. So if you have any questions regarding that process, about our Safety Council in general, about future topics, or anything related to Safety Council, feel free to contact me. I am available through all of the ACI channels. You can access my information on the ACI website, or call me at the main ACI number, 513-221-8020. And I'll see you all next month on October 20th Our October meeting will feature the topic of workplace distractions. Following this meeting, a small group of steering committee members are asked to stay on so that we can have a quick conversation. But I'll say farewell to the rest of you. Have a wonderful day. Stay safe. Take care. And thank you again for joining us.